Hi, good people. I hope you're well. Today we are looking at NCLEX, and our primary focus. We just want you to have a broader view of NCLEX. What does it test? Like eliminating options that are clearly wrong or even incorrect. We'll be looking at various things where we'll also be showing you some questions and how you're supposed to answer. So ideally, the video is all about what does NCLEX contain, what are the ways, what does it test, and eventually how to pass NCLEX in general. Okay. So NCLEX, just for an introduction, it's a national council licensure exam and is always required in order for you to obtain a license to practice as a registered nurse. Okay. So once you asked about what is NCLEX, it's always once you've done now this national council licensure examination, you'll always be given a license, okay, for you to practice as a registered nurse. Okay, so the exam is always administered by the National Council of State Boards. Okay, and this board always ensures that your license is always acceptable throughout the entire United States and also its territories. Okay, so ideally we are just focusing on United States and its territories for you to be able to practice in it. Okay, so by once you pass these tests, you'll be able to practice as a registered nurse. The test itself is always based on specialized knowledge. So in this video, we'll try to look at different answers or different even questions and how we answer them and what are the target. How do we rule out the answers for we to be at par with the NCLEX exams. Apart from that, you ought also to know that NCLEX does not necessarily test what is in the books. So you'll always see there is always they'll try to blend what you've been practicing, your general knowledge, and on the ground. That's mainly NCLEX. Okay, so you should have at this point. Okay, and it tests your skills, abilities to meet the various requirements that will be required within the nursing process. So this means once you've already passed your NCLEX, you're able to practice throughout the entire United States and its territories. Okay. So because this test is a test of basic competency, you will be able to demonstrate your abilities as an entry-level nurse in this exam. Okay, so that's all about NCLEX. Okay, so what are the certain points and concepts that are integrated throughout the client needs categories and also subcategories? So we mainly focus on nursing process. 2, we talk of caring. 3, we talk of communication and documentation. 4, we talk of teaching and learning. Okay, those are the 5 key things that we ought to look. So for the nursing process, this is always a scientific approach. This is always a scientific approach to a client care that includes data collection, planning, and implementation and evaluation. That's ideally a nursing process, and we usually use the acronym ADPI. Okay, so it always assessment, diagnosis, planning, implementation, and finally assessment or evaluation. Okay, that's something about nursing process. Then caring is always interaction between you, so it involves you as a registered nurse. So it means you've already passed the NCLEX. Okay, and the clients, their families, and their significant others. Client care requires mutual respect and also trust. That's about caring. Then a point about communication and documentation. This is always the utmost importance that you are able to be clear and conscious. So ideally what you've not documented, it's something that you've not done. Okay, so that's why documentation plays an important role. Okay, so this always requires the ability to communicate both verbally and non-verbally, and to be accountable in keeping and maintaining records and patients charts. Okay, so for example, let's say you've you wanted to do vital sign, you wanted to take blood pressure, so you ought to have a proper communication between you and your client, where you build up some rapport, then you explain the procedure. At this point you are taking the part of communication. Then eventually you're supposed also to document. Okay, that's why we are saying you keep and maintain records of patients charts. Okay, finally with teaching and learning. Okay, so you've also to demonstrate the appropriate skills and attitudes that promote changes in yourself and others. Okay, by learning the ability to share information with clients and their families. That always plays also an important as a nurse, as an educator, apart from an educator, you also play a role as an advocate of the client. So you ought to teach your client, okay? So what are the exam preparation tips that you're supposed to have while you're preparing for NCLEX? So after learning the materials, you might want to use a number of testing tips. So one, you can read the question carefully. That's always key. Then you also look for keywords. Apart from that, you also watch for specific details. So throughout our discussion, this is what we'll be trying to do. You ought to read your questions carefully. You ought to look for keywords. Then you ought to watch for specific details. And for you to be at par with this NCLEX, okay? Now, how do we eliminate options that are clearly wrong or incorrect? These are the mainly sort of questions that you'll always find while you are doing your NCLEX, okay? So by systematically eliminating distractors that are clearly incorrect, you increase the probability of selecting the correct options. So it means if we try to eliminate the answers that are incorrect, let's say these are our answers, okay? So if we try eliminate, this is incorrect, this means that we are increasing the probability of getting this other one as the correct answer, okay? So look for the answer that differs from other options. So for instance, you might find you've read a certain question, then you are trying to eliminate. So one tip, let's do that we have, we are told you're supposed to look for the answer that differs from other options, okay? That is always the test strategy. So this is our option number one. This is always called odd answer out, okay? Let's do an example. The nurse is attempting to evaluate the client's knowledge of diabetes. Which statement by the client indicates further teaching? A reads about, the client states that he will check his blood glucose levels before meals. The client selects a 10-ounce stick from his menu. The client demonstrates how he will give himself insulin. The client verbalizes understanding of ways to improve circulation. Let's remember what we've said. We've said the odd answer out strategy, okay? So if we go back to our answers, of course, the correct answer is B. Why? Because if we try to eliminate, if you see option A, C, and D, they all indicate knowledge of diabetes. The odd one out, let's try and see. The client states that he will check his blood glucose levels. This is always, it's key, okay? The client selects, let's leave that out. C, the client demonstrates how he'll give, this is also correct. Then the client verbalizes understanding, okay? So if we use the formula that we've said of the strategy that we've talked of, the odd one out, the odd answer out, where we look for the answer that differs from other options. If we use this strategy, now we are confident to go with option B as our answer, okay? So that is the first clue that you're supposed to look at. So you eliminate options that are clearly wrong or even incorrect, okay? What's the other thing that we can also use? We can look for opposite answers. How does this come about? So when you see opposites, one of these options is usually correct. Don't forget about that. Let me underline it for you. When you see opposite, one of these options is usually correct. Here is an example of this testing strategy. The client with hemophilia is admitted with bleeding. Which action by the nurse indicates an understanding of hemophilia? The nurse applies heat to the joint. The nurse applies ice to the joint. The nurse offers to perform passive range of motion. The nurse elevates the extremity. Remember, we are looking for opposite answers. And we've said when you see opposites, one of these options is usually correct. Is there any opposites that we can see? With applying heat and applying ice, okay? So option B is always, it's correct. Why? Because hemophilia is always a genetically obtained disorder in which there is an absence of clotting factor, okay? So when you apply heat, it vasodilates and causes increased bleeding, okay? then this answer is the opposite of the correct choice, which is B. Answer C is incorrect. Okay, so let's go back. So we've said the opposite one is always correct. So you've seen where they say we apply heat. So we've talked of hemophilia. We're not supposed to apply heat because it causes more vasodilation. Then we're also at risk of more bleeding. So the opposite of heat is always cold. That's why you go with B as our answer. So that is strategy number 2. Okay. So those are the 2 strategies that you can apply while going through these NCLEX exams, and you can just post it down if it has helped you. Next, let's look at what are the types of questions that are always asked. Okay, so the most types of questions are always multiple choice with 4 options. Okay, however, other types of questions such as the questions like fill in the blanks and even identifying items with hotspots, what does this mean, or even you might be given some sort of illustration, a table, even perhaps a chart, because it's always computerized, the machine can identify the spot where you clicked. Okay, but the most common ones are always the multiple choice questions with 4 options, but you can also get others. Let's look at the multiple choice format. Okay, so most of standardized tests that you've probably taken throughout your educational career, you'll always find that they always contain multiple choice questions. Now, for some reason, these types of questions, they always give a large percentage of test takers a difficult time. That's why you always find most tests, you'll always find we have multiple choice questions. So if you approach these questions carefully, they should be easier than you think. But you'll always find there are other people who find or tend to find them being that hard. But if you have a good approach to this question carefully, you should always see that they're always easier, okay, than you think, okay? Then you have to click on it with your cursor, then for you to identify your correct answer. So how do we do? First, you are supposed to read the question and see whether you know the answer. If you know it, automatically you can look at the choices and select the correct one. Okay? Can we do an example? Or let me just repeat what we've just said. First of all, for MCQs, you're supposed to read the question and see whether you know the answer. I've read the question. Do I know the answer? Then if I know it, then let me go now look at the choices, then select the answer. Let's do an example. Mammography is used to detect which one of the following conditions. What is mammography? What is mammography? It's supposed to come into your mind, okay? So you ought to know that mammography is always used to detect tumors or even cysts in the breast, okay? So it's not used to detect any other complications. Of course, you should know that mammogram is always an image produced by low dose X-ray of the breast. Okay. Then when you talk of like epilepsy is a disorder of the central nervous system. Okay. So we've just looked at this tip. Read the question, see if you know the answer, then go select the answer. Mammography, you are thinking of the breast, you are thinking of something like CA, so it involves something like tumors. Okay, so if we come back to our answers, we just click the tumor. At that point, we are okay. Epilepsy, that is not related to edema, it's not related, pain is not related. Okay, now exercise for you. Which of these questions, when asked by a nurse, assesses for major defining characteristics of disturbed body image? That's your question. Next reads about when a child demonstrates a positive Babinski sign, which age child will be most important for a nurse to follow up? Babinski. Do you know something about Babinski? It's a reflex, okay? Now what is the appropriate age most important for the nurse to follow up? So you always ought to know that Babinski is always a positive sign in children 12 months of age, even younger, okay? So Babinski will be a cause for concern and further evaluation Okay. So a positive Babinski is always normal for 4-6 months. Then a 12-month-old child has not a cause for follow-up. Okay, so we have to do health promotion and also maintenance. Okay, so as you're answering these questions, always just remember the tip that you've talked. You read the question, see whether you know the answer. If you know it automatically, you can look at the choices, then you select the correct one. Okay, up to that point we are at par. Next reads about which of the following clinical manifestations should the nurse document as a positive sign of pregnancy. So we're just looking at positive signs of pregnancy. So for pregnancy, we've presumptive, we've probable, then we've positive. Okay. Presumptive is mainly what the mother tells you. Probable, you can look at them like Osiander's sign, Hager's sign, Godel's sign, among other ones. Then positives, mainly we check for the ultrasound. PDT is always part of, it's not positive, it's, you can also confirm that. So we are just looking for positive. Amenorrhea, this is presumptive, no? Uterine shuffle, that is presumptive. But fetal heart rate, this is always positive. So we go for fetal heart rate. Let's look. Fetal heart rate can be detected by Doppler as early as 10 to 12 months, okay, of pregnancy. Okay. Amenorrhea, absence of menses, that's always presumptive. So if you've read the question, then you've known the answer, so you can just go select your answer, then continue on, because also the exam is timed. You don't have more time. Your patient's blood work shows a low serum albumin levels. She is receiving anticonvulsant, that is Phenytoin, which is 95% protein bound. You should monitor your patient for sign of. So you ought to know about how we relate the low albumin, the anticonvulsant, which contains 90% of protein. Yeah? So what should you monitor for? So you ought to know that with the low serum albumin, more free phenytoin is always available in circulation. So this free phenytoin is always an active form of the drug. So for hypoalbuminemia does not always induce hypokalemia, CNS, depression, and also hyperalbuminemia. Okay. So that is something that you need also to have under your fingertip. 5 talks about which type is known as the universal recipient. Do you know about the universal recipient? Yes, of course I know. It's always blood group AB. If you know, just go select it. Okay. A client with which of the following condition is at risk for developing low magnesium levels? What do we think about low magnesium levels? So we look at like for clients mainly with, so like for this question, you don't know, probably you are not sure or you have a clue, so you come check your answer. So I'm thinking of something like alcohol. Now, how does we relate alcohol with developing low magnesium levels? For alcoholism, it always creates a risk for developing low magnesium levels, and this is mainly due to issues with nutrition. So we talk of nutrition deficiency. Okay. Yeah, so we'll go with alcoholism. 7 talks of continuous passive motion devices, that is always CMP. What are CMP? So you always need to know that the purpose of these CMP devices or CMD devices, they mainly work so as to move the knee joint without weight bearing or even straining muscles and stimulating regeneration of articular tissues following orthopedic surgery of the knee. So like for this other question, you'll find some of the things they are not found locally, but if you go to other states like the United States and other developed countries, you'll always find they're always there. So it's also something that you need to have the knowledge within your fingertips or within your head. Yep. 8 reads about which finding assessed during a bed bath indicates to the nurse that the client has poor hygiene practices. So what comes to your mind? Poor hygiene is how the person is always kept. So we talk of unkempt fingernails and also toenails. Okay. The signs and symptoms of smallpox are similar to those of. So you ought to know about smallpox. How does it present? Okay. So In most cases, they will always be similar to those of chickenpox, where we have rashes which appears first on the trunk and spreads to the extremities. But for in smallpox, the rashes always begins on the extremities and spreads to the trunk. So it's always the opposite. Chickenpox, we start from the trunk, then extremities, but smallpox extremities, then to the trunk. Okay. So up to that point, we've really covered the NCLEX in detail. Then we've just looked at its definition. We've looked on how do we tackle these questions. Then we've just also come up with some of the tips or the tricks that we can use. Of course, we've listed around 4 of them. Then we've also done a little bit of some examples with practical questions for you. So if there's any other question, you can just post it down the chat box, then we'll answer. Thank you for watching. Bye bye.